Our third paper will be by Dr. Li Hui Su. How does iliosacral bone tumor resection without reconstruction affect the ipsilateral hip joint?
Thank you, Chairman. So when the iliosacral region was involved by tumor, and reconstruction after resection is very difficult. And the reconstruction after resection is very difficult. And prosthesis and allograft reconstruction may provide good function, but sometimes result in some complications such as infections, blood loss, and non-reconstruction is a very simple way and less cost. But there are some worries about the stability of the ipsilateral hip joint and the function of the patients. So our objective is to evaluate the functional outcomes and oncological outcomes after the iliosacral resection without reconstruction. From 1998 to 2016, we totally have 18 such cases. There are 6 male and 12 females. The mean age is 33 years old, and most tumors are malignant tumors. The mean follow-up is 7 months. To describe the pelvic drain defect, we defined eye distance as the line from the iliosacral joint to the upper line of the acetabulum. After the iliosacral tumor resection, the pelvic ring will lose some bone and the eye distance may lose some defect. So we totally have 10 patients. The eye distance defect is more than 1/3. Another 8 patients, the eye distance defect is less than 1/3. And the results, the limb discrepancy is very common. The mean shortening is 1.7 centimeters, and 6 patients, the shortening is more than 2 centimeters. All of them, the IED defect is more than 1/3. And 12 patients, the shortening is less than 2 centimeters. And 4 of them, the IED distance is more than 1/3, and 8 patients, IED defect is less than 1/3. The change of the ipsilateral hip joint, to evaluate the acetabulum coverage, we use two parameters. One is API, means acetabulum head index, and the other is the central edge angle. And 8 patients, API is more than 75%, that's good. And 7 of them, the eye distance is less than 1/3. And 10 patients, the API is less than 75%. This means worse coverage. And 8 of them, the eye distance defect is more than 1/3. Post-operative C angle and 11 patients is over 20 degrees, and most of them, 8 patients, is less than 1/3 eye distance defect. And 7 patients, the C angle is less than 20 degrees, sorry. And all of them, the eye distance defect is more than 1/3. So oncological outcomes, we totally have 3 recurrences: 1 chondrosarcoma, 1 desmoid tumor, and 1 giant cell tumor of bone. After second resection, no further recurrence, and no amputation. No metastasis was found, and all alive at the last follow-up. And this is the 3 typical patients after resection without reconstruction. Hopefully we can see the video. Okay, the mean MLTL score is 93%. So no patient feel pain. The MLTL score is good. The limb discrepancy is not very serious. And until now, the degenerative change is not obvious. So from our experience, the iliosacral resection without reconstruction, not the only option, but we think it's an option worth to try. Thanks for your attention.